Yeah.
So I guess we're ready to start with ARPA. Morning, Chris. How are you?
She didn't be in there. I don't think there's a bar.
Everybody's ready. We'll go ahead and call this meeting to order. Take 16. We're running just a little behind. We can get this in here. It's Tuesday, July the 19th. Call the ARPA meeting to order and start out like I always do and say that, you know, the federal government issued Marion County $8.5 million. They had nothing to do with it. They laid it in our lap and said, here, it's COVID related money. Our responsibility is to spend it or to delegate it or we have distributed 5.4 million, something in that neighborhood. We have approximately 3.2 million. So, yeah, we received 8.5. We spent about 5.4. We've got about 3 more left. We have 2014 to allocate the money, appropriate the money, and we have 2024 to appropriate the funds and 2026 to spend. So what we're going to be talking about today is the healthcare sector. And here's where we're at. I've been getting some calls. Tim's been getting some calls. Carl's gotten some calls. I don't know if Chris has got any calls related to this or not, but here's what the calls sound like. This is so-and-so pharmacy. I understand that TJ Sampson's pharmacy employees receive benefits from ARPA. Why didn't we receive benefits from ARPA? We did testing. Don't know if TJ did testing or not. Don't think they did. We did testing. We dealt with COVID patients. We stayed open during the whole time. Why didn't we receive ARPA funds? My answer to them is I'm not sure why we didn't receive ARPA funds. Well, that's really not a good answer from them. They don't accept that very well. Same goes with the doctor's offices. I've had some private doctor's offices call me. I think Tim has too. Want to know why Dre's Gilbert, which is a doctor's office, received ARPA funding to this division, which is mainly doctor's offices received ARPA funding, and they did not. They stayed open during COVID. They administered patients. They did all the things they were supposed to do. They done what they say is equal weight work, but yeah, they didn't receive any funds. We also have a long-term health care facility that was called. They were asked for the numbers, how many people they had were eligible. They told their people that they would receive funding, yet they did not receive funding. So we got, I guess, two questions in my mind. One is how did we get here? We talked about 2,000 healthcare workers. I think 1,043. Is that right? 1,043 received benefits.
I'm not sure.
Madonna, do you know the exact number? 1,076. So we're talking about somewhere around 2,000 and 1,076 received benefits. That's question number one. Is how did we get here? And number two is how do we level the playing field so that all the healthcare workers get treated fairly? So, suggestions.
Well, I looked at the video of that fiscal court meeting. And you made a motion that we give money to the hospital. And I'm paraphrasing, I've looked at it half a dozen times. Ray Gilbert Clinic and the nursing homes. That was the motion, but the number of employees was mentioned as 1,800 and 2,000.
Right.
So I guess TJ took that, even though we had all these meetings and talked about what we wanted to do, that they took that literally, and that's the way they did it. The only problem I got with that is in our contract, there's a company named Assist. 13 employees, it wasn't mentioned anywhere. They got money. The question is, why did those 13 employees from Assist get money and the pharmacies and the others didn't?
I can tell you.
Okay.
Because when we first started talking about this, the interim final rule was in place. We did not have a final rule on the money, and the listing in the interim final rule said nursing home, hospitals and home care settings. And Amedisys falls under home care settings, right? Okay. So in the meantime, after the beginning of this year, as the conversations went on, the definition of an eligible worker changed somewhat and was expanded. And honestly, LaDonna didn't have access to that information. She only had the original, the interim rule entrance motion.
Okay.
So that covers what was covered. I mean, that
I understand that, but it's been told to me that we took that motion and that's what we made the rules by.
isn't that how it
And that
works?
Well, except Medicare wasn't in that motion. Okay, so we can go back and we can say, well, in previous meetings, we talked about pharmacies, we talked about dental offices, we talked about assisted livings. We talked about all these other things, and they weren't included. But the motion is said, we said TJ Sampson Hospital, we said Grace Gilbert, and we said the nursing homes. Medicare was not mentioned in that motion, but we're using the motion. It's a double standard. We're using the motion in one aspect, and the other aspect, we're not going to use it because we wanted somebody else to get it, to got it. Okay?
If you go and listen to the whole motion too, I mean, it was clear that I said all healthcare workers, all 2,000. I said that twice. So I watched the meeting twice too. So, I mean, you know, we had talked about 1,800 to 2,000 since day one. And all of a sudden we end up with 1,076.
I found some notes I had taken the day that we did this. We had TJ at 1299, nursing at homes and stuff at 607, Grace Gilbert 44. This is notes from that day. And some of the other managers can remember after the meeting, we set up and figured out that most people were going to get around $500. And time again, we talked in our ARPA committee meetings, we didn't want anybody left out. That was the main thing. We didn't want anybody left out. And if you take what you did from a motion, that the words that Trent said, that was a general statement. Everyone knew that we wanted everybody included. There's no way that we want to leave somebody else and cause a problem like this. And I think it was not right the way it was done. I'll take part of the responsibility that we didn't make ourselves clear enough, but I thought after saying, and I know when after the contract was written, the judge signed it. And Judge, I'd just like to ask you, do you think it was done correctly?
I'm reading the minutes now. I do think there are some folks that have been left out. I've got some names of the calls that I've taken. You know, how we get there, irregardless of how this was written, how that was said, we've got people who need to be paid. I think we've got money available. It's allocated to pay.
So you don't think it was administered correctly, right?
Well, I'm not on trial for anything. I just think that we've got people in the community that needs to be paid. we've got the money to pay them, so let's just pay them.
Well, I think that, you know, I'm a little bothered about it, but I can move past it because, you know, I think the people that got money, you know, we'd always talked about somewhere around, we'd always talked about, from day one, we talked about 1,800 to 2,000 healthcare workers and $500 a piece. We talked about that over and over again. So, so I'm a little blindsided by it, a little upset about it, but you know, we gotta make it right now, so we gotta move past that part of it. And we gotta make it right to those who didn't receive benefits. And that's what's important to me, is these people that work just as hard and in the same environment, they should receive the money just the same. You can't exclude them because they're not a TJ employee or they're not employee of this or that. So we've got to make it right to them. So what I would like to do is to see Krista and Donna get back together and let's draft up or amend our agreement that will include, when we started with the 1,800, do you have a breakdown of what we originally talked about on the original 1,800?
I'm pretty sure that was just an estimate of going to some places that they thought originally would be included. I mean, I could be way off base, but the way I understood it is that was, let's see how many people would qualify if it was X, Y, Z. And that was just an estimate. Because after the motion was made, I ran into Denise at dinner and she said, I'm really concerned because several people are gonna be left out.
Well, I mean, that should have threw up a red flag. I mean, I would have thought the red flag would have come up at that point.
Well, we had been talking about making parameters, setting parameters and making rules for this money. So that's, you know, I think it's a case of mixed messages. And I think that, I mean, I don't think anybody did anything on purpose. I think we just need to figure out how to fix it or whatever you guys.
Did you have any questions with Donna about the number? You was good with the number from when y'all talked?
So the only insight in regards to the 1,800 was, the court asked an estimate of at that time, how many hospital nursing home and home care employees would we estimate in the county? And that was about 1,800. Then later, the court set a criteria of employees that were continuous employment from March 13th, 2020 to March 13th, 2021, and that's when that number obviously shrank because some people had left the job, some people had started a job that they had worked during that time period at the same employer, that they were not eligible. And that's when that number went from 1,800 to 1,000 for 176, 1,076.
If employees were on furlough, they took off during the COVID, they still got paid. It's my understanding. They took off a month, 2 months, 3 months. I've been in contact with some that said they still got the bonus. And I was just wondering about that. Is that the way that it was supposed to be?
I can speak for the hospital. And I would have to go back and look because I want to make sure you do that. I can tell you if people work during that time as a full-time employee where they furloughed in during that period, did they receive money? I'll come back and get the exact amount they did in our organization.
I'm like Trent. I think we need to move forward on this. The hospital could help us out some. But I'm of the opinion that we need to give the community and I mentioned this back in December when we first talked about this, just get a list of people that feel like they qualify. And then take the time to go through that list and decide who really qualifies and who doesn't. Instead of us just saying, hospitals, home agencies, Graves Gilbert, instead of just picking out certain areas to do these things. Because my understanding is TJ Sampson Hospital and the clinic in Cave City are two different entities, are they not? The hospital in Cave City, is that not a clinic? Or
Although
the,
the hospital, umbrella,
but is it a hospital?
it is considered.
It's a hospital. Is the pavilion considered a hospital?
Service.
The pavilion
They are, it is.
is considered a hospital.
Hospital-based
I
service.
did not know that. I thought it was doctor's offices, but anyway. TJ Sampson, it's not TJ Sampson Health Partners, it's TJ Sampson Hospital, the whole, all over the whole. We all advertise TJ Sampson Health Partners on TV, I'm just curious.
I think when it was originally formed back in 2011, they did, but that entity was
Okay.
phased out 2 years after.
But it's still in y'all's advertising. I just- I didn't know. Anyway, okay.
Okay, so, LaDonna, Kristen, can you get with LaDonna and Denise, I think was in this, if they're willing to do this, if not, we can do some actions or do it
I
ourselves.
just think we need to do it.
I think that they,
I take time.
I'd be
let's,
happy to have,
let's ask them to give us a rough draft of a new agreement.
I'll
That
be
will-
happy to write an agreement, for you guys to look at, and also have any doctor's office and or any other entity contact me who think they qualify, and then you guys can.
All right, let's go ahead and set some
Because I think
parameters
you'll
here
feel
for the
better
new
about
agreement. So we're gonna say doctor's offices that
Don't
stayed
you think
open.
you'll feel better about that?
I'd rather advertise it to the people that feel like they qualify, send us their qualification, whether, regardless of what it is.
LaDonna's wasted enough time.
That's
I
fine.
mean, not wasted, but
I'll have-
this
We
is
still have to have
obviously
some
not her
parameters. Let's say
full-time
doctor's
job.
offices that, stayed open during COVID. Assisted living,
Long-term care,
all
assisted living.
long-term care health facilities, regardless of what they charge or what their standard of living is, we need to include them all. And then if TJ's pharmacy employees receive benefits, they did, correct?
If they meet the criteria, they do.
Then we're gonna have to include all the pharmacies that stayed open during during COVID. I mean, we'll have to. It would be unfair to do it any other way, right or wrong?
You're right.
Is there other
So where
labs
do you
across
wanna
the
aim?
state?
It had to be in the newspaper.
So we're
And
talking
maybe
about,
if we got, put it on the county webpage as well, that's free.
we
I
got
don't know how many people
pharmacies
look at it.
and,
Y'all got a webpage, you can advertise it on? Just on there. Or can you do that?
and then the other urgent cares.
I'm reluctant to do it, and I'll say why, because there's a perception out there that the hospital allocated this money and determined who got it, who did not, and that's just not the case.
Well,
The
with all due respect
contract
to
that
you-
provided to us,
when I saw a med sales assist on there,
yes.
I questioned that myself. to be honest with you.
I would say that that was included in the contract that was provided by the court to us. So
Yes, it was, but it wasn't included in the motion, everybody goes back to, let's move forward.
I would only know when you all provided us, and the numbers you provided us.
Let's move forward.
I certainly wouldn't add a company that I don't know
I
anything
understand.
about.
I understand.
So to say that I wouldn't advertise as well as be a part of moving forward, because I don't want any misperceptions out there. We're very grateful for what we did for the hospital system. But we certainly don't want to get into the middle of misperceptions out there that we are determining where and allocating and who's included and who's not.
Okay.
We'd rather not do that.
So the new rough draft of the agreement should include the doctors, all doctors' offices that stayed open, all assisted living, all nursing, long-term healthcare facilities in Barron County, all pharmacies that stayed open during COVID and dealt with the COVID patients, and all CJ's urgent care in Cave City received funding, their employees received funding, and so did the one at the pavilion. Then the other two, I think there's two, is there two other urgent cares in Barron County? I think those two other urgent cares should receive funding as well. Do you have those in the rough draft?
Yeah, I have notes here. I don't have a rough draft. Would you like for me to write the ad?
What I would like for you to do is write us a rough draft and let the magistrates look at it. Let's talk about
Of
it.
an agreement? Okay,
I have
you got it.
a
Somebody from Fort Worth, Marty, go ahead.
or comment, y'all just hit on something that I know a little bit about. My wife works, at a harness key and a durable medical equipment business. You know, wheelchairs, wheelchairs, oxygen, etc. Now, you mentioned the pharmacy, the durable medical equipment business, where she works. They have at least 2 people who go to homes, deliver oxygen, setting up oxygen. Obviously, anybody on oxygen is a critical care patient. But all during COVID, they were going into people's homes and providing oxygen, setting up medical equipment.
I have a question. So are all of the durable medical equipment companies connected to a pharmacy?
In glass, and I'm talking about them healthcare, medical arts.
Okay, yeah, and so is,
Healing Products does.
Right.
They're in the same position,
uh-huh,
very pharmacy, and they do DME. I don't know, there may be another oxygen provider in the area.
okay,
I don't know, those two, I know about, you know,
okay.
Any more home
I'm
health?
just-
What did you call that?
You know, if you're gonna make this wider, you might need to look at those folks.
Durable medical equipment providers, okay.
And I know Elays and Family Healthcare are at least two of them.
Are there any more home health besides medicine? That's it.
Intrepid
Yeah,
Home Care.
Intrepid
Home Care provides home health.
Intrepid Home Care. They weren't included.
Not to my knowledge.
Are you with Intrepid?
No, I'm with that. Medicare. Medicare, the home oxygen. I'm sure they were going in. I think the listing never.
It really is. Healthcare is an area that's going away, and I think when, yeah, I think when we set parameters, we didn't realize, not we.
Trent, it just, and I don't, let's just set parameters, and then let's advertise. If anybody feels like they're being slighted, let them say, no, I deserve to be there too.
Right.
Then we'll just have to look at it case by case.
Yeah.
I mean, that's what,
So do you?
that's the way I think we need to do it.
Well,
So
I just
should
think
we-
in our language of advertising, we have to set some
Yeah,
kind
I'm
of,
saying-
we have to say if you are part of a doctor's office, assisted living.
So
Et cetera,
durable,
et cetera, et cetera.
I need to include durable medical equipment.
If
Doctor's
they
office.
worked, if they were operating during that time
Sure.
frame, March to March, and if
Right.
they dealt with COVID patients.
I think exposed to COVID or worse.
So don't
during
list-
COVID would be a pretty good
Yeah,
opportunity to
exposed to
expose.
COVID.
So don't list these, just put, if you work in any kind of medical care.
No, I think you need to list, rise up a rough draft agreement for us to look at that includes all doctor's offices that were open,
Uh-huh.
all assisted living / nursing homes,
Mhm.
all pharmacies that stayed open, all urgent cares, and any other healthcare provider
Okay,
that may have dealt with, that was open from March to March, and that was directly in contact with COVID patients.
okay,
And let us look at that before we advertise. I want to read,
Okay.
going forward, I want to see it before I sign it. Agreed.
and this is a draft agreement
It's a draft
before we
agreement.
do the ad.
Yes,
Okay.
absolutely.
Mr. Chairman, I got a question for you.
Yes, sir.
The federal criteria says that even though they work during that time, if they're no longer an employee and on a payroll, they're definitely not eligible,
Right.
even though they worked that year.
We're using the same rules.
Okay,
We
even though they
use
work
the
that
same
year.
rules of engagement as we use with TJ.
Also, with the calls that I have, some of these folks went from a nursing home to TJ or from TJ to a nursing home, and they never missed a day. They may have left their job from a nursing home on Friday, went to TJ on a Monday. So,
Right now, we have 30 employees.
okay,
I have
in
that those same
that-
calls, emails, probably the same
from
ones you
the-
have with me.
The original agreement, so we need to figure out what to do with those 30 folks.
We're gonna put them in with them all. When we do this, we advertise, we're gonna set a time frame. And whatever that time frame is, whatever comes in, be just like a bid, whatever comes in on that shut off date, that's it. We're cutting it off, period.
Okay,
So, and they'll be included in that package as well. That's the way I see
It's fine.
it. Okay?
Sounds good.
Anything else with Donna? You guys got anything? Go ahead. Not.
thank
Motion
you,
that we
Lana,
adjourn the meeting.
for your work.
But, yes.